My name is Amir Moradi. I'm a facial plastic and reconstructive surgeon and have been practicing in San Diego County for the last 26 years. Today we're going to talk about facelifts. The reason that when one looks online and gets very confused with what the facelift is all about is, although the anatomy is complex, but the methods are pretty straightforward. But unfortunately, so many different names and brands and emphasizing different specifics causes significant confusion from a patient standpoint, trying to understand what exactly is done. So in my opinion, whether there are marketing terms or different types of surgeries, majority are just marketing terms and not necessarily different surgeries to an extent. The question is, what are we trying to address? So at a younger age, let's say at the age of about 41 or 42, all the way up to about 46 or 7, many a times it's only the jowl area that is causing the issue. For those, most of the time the incision is actually stops right there. We go in, we get under the SMAS in this fashion, elevate the SMAS by releasing all the ligamentous attachment, bringing the SMAS up in this fashion, and then redraping the skin without putting any pressure on the skin. So that is limited incision, lower face, deep plane facelift. Now, when individuals have laxity of the neck tissue as well, in particular of the platysmal muscle, now the tissue under the skin, again referred to as SMAS, is connected to the platysma here. So we want to go ahead and get into the plane, release all these ligamentous attachments, come to the neck, release the cervical, what we call ligamentous attachment. And these are these two units are connected, and bring them up at the same time as a unit. And that actually brings up the lower face and the neck. So that is for individuals with further laxity that extends not only to the lower face but the neck. So that becomes the extended deep plane of the lower face and the subplatysmal area. The way I look at performing a facelift, I want to make sure it is tailored to the individual this is work on. And to do that, there are many things you take under consideration. Number one is what bony structures do they have, because the bony structures can't really be changed. So you have to tailor your facelift to match that bony structure. You have to look at the thickness of the tissue, the facial features, knowing that how did that individual age, because most important is to give a natural results, but that looks 15 to 20 years younger. So to do that, then my level of dissection, my level of elevation of the SMAS and the platysma would change. How I make my incisions sometimes is changed. Whether I'm going to use fat transfer, their own fat for volumization of the face may be necessary in those individuals. So there are multiple factors that may have to be varied, but the most important thing is bringing the most natural look that is suitable for the individual, the patient you're working on. So the best way for individuals that are interested in having a facelift or the questions are for them to come in and have a conversation with us, ask all the questions they have, and be educated. And our job is to educate our patient and let them make an informed decision based on all the facts that we have provided to them.